Hello, how are you? Today I'm going to be talking about 7 important signs your urine gives about your health. What color is your urine? Does it have a different color? Is there anything unusual? Is there foam? Stay with me until the end because you won't want to miss this. First of all, if you're new here, welcome. Subscribe to the channel and turn on the notification bell. There are new videos here every day and you won't want to miss them. If you know someone who could benefit from this information, share this video. Let's work together, you and I, to expand this chain of good because that's what I want here with the channel. I decided to list 7 signs that might appear in your urine so you can pay attention the next time you go to the bathroom and see if it's trying to tell you something about your health. So let's get started. The first thing is orange-colored urine or orangish urine. Often this orange urine can appear after you take some kind of medication, such as an anti-inflammatory or an antibiotic that contains an agent, for example, a compound in its composition that can pigment your urine. This can also happen if you consume foods with orange coloring, so don't worry. But it's also very common if your urine is very concentrated, if you've spent a long time holding your urine during the day and drank little liquid. In other words, it's also a sign of dehydration, so you should pay attention to that. Green urine. Have you ever heard of green urine? This is rarer, more unusual. It can also be related to some food colorings. Always remember that everything we consume, we will eventually have to eliminate, and avoid consuming food colorings because in reality, they don't add anything in terms of flavor. It's just a visual matter, and they can overload our excretory system. So ideally, we should avoid consuming artificial colorings as much as possible. But in the case of green urine, it's not just related to food coloring. Once again, certain medications can also tint your urine. This is usually something you'll notice because when you stop taking the medication, your urine returns to its normal color. But it can also be caused by a Pseudomonas infection, a type of microorganism that is very dangerous to your health. So if you're not taking any new medication and you haven't eaten any green pigmented foods and your urine suddenly starts turning green, it's very important that you see your doctor to check if you have any other underlying health condition. Some people have brown urine, what we call Coca-Cola colored urine. This brown urine, once again, can be closely related to extreme dehydration, meaning the urine is very concentrated, but in the vast majority of cases, it is associated with liver problems. People who have liver problems usually have what we call Coca-Cola urine, that is dark urine, and pale, somewhat yellowish stools. So if you already have this combination of both, or if your urine suddenly becomes darker, more brownish, it is very important that you consult your doctor to have the necessary tests done. Foamy urine. What could this actually mean? First of all, it's important to mention that it's quite common in both home bathrooms and public restrooms for certain types of cleaning products to be present in the toilet bowl. This includes specific soaps or those scented baskets people often hang inside the toilet, which are meant to provide fragrance and help clean the bowl with every flush. So this could be due to the soap from these products, the chemical compounds related to cleaning the toilet itself. But if your toilet doesn't have any of that, if there's nothing in your toilet except water, and when you urinate, it becomes very foamy, it could be related to a high amount of protein in your urine or kidney problems. Of course, for men who often urinate standing up, it can be related to the agitation of the water itself, because sometimes the urine falls from a greater height than it does for women. So it's important for you to check if after you urinate, it continues to be foamy. This is an interesting detail for you to observe the next time you go to the bathroom. And shades of yellow. It can be a light yellow, a normal yellow, like golden, or a slightly darker yellow. This is truly normal urine, which is what we expect to see in the toilet. Urine naturally has a somewhat golden, somewhat yellow, transparent color. Ideally, it shouldn't be foamy, and there shouldn't be anything unusual present in it. It could also be that your water intake is within the normal range throughout the day, but you concentrate a very large amount of water at specific times. Some people wake up and drink 4 or 5 cups of water, and in the morning their urine is transparent, but then they don't drink anything in the afternoon. So the ideal is to spread out your water intake throughout the day so that your urine maintains its normal color. Transparent urine. Many people say that you should drink water until your urine becomes transparent. In reality, transparent urine means that you are drinking too much water. There is such a thing as excess water, and this can also put a strain on your kidneys. So, the most ideal is for you to drink around 10 cups of water per day. This will depend on your height, your level of physical activity, and where you live, whether it's hotter or not. But if you notice that your urine is already very transparent, almost like water, maybe you don't need to drink that much water. Some people, when they go to pee and take a look in the toilet afterward, notice that their urine appears reddish or has a pinkish tint to it. Of course, this can happen to some women during their menstrual period, but for women outside of their period, or for some men, it may be related to some kind of bleeding in the urinary excretory system itself. So it could be some kind of kidney stone that has moved down and scratched the urethra a bit, or in the renal calyx, it could be related to some bleeding somewhere in the kidneys. And the presence of blood in the urine always requires you to consult your doctor to find out why. After all, blood has appeared in your urine. Any questions or any problems you have with your urine, it is very important that you always consult your doctor. It could be a sign of a urinary tract infection, and urinary tract infections are very dangerous. It may need to be treated with antibiotics. A urinary tract infection can progress very quickly. I even have a video here on the channel talking more about urinary tract infections, the symptoms. So always remember to take care of your health, and if you have any questions, consult your doctor, who will be able to guide you better about this. What color was your urine the last time you went to the bathroom and peed? Tell me here, I'd love to see your comment. Share this video with anyone you know who would enjoy this information. Let's work together, you and I, to expand this chain of good, because that's what I want here on the channel. Like the video, because that really helps me out. Subscribe to the channel and turn on the notification bell. There's a new video every day about fitness, health, nutrition, recipes. You won't want to miss them. See you next time. Bye.